Okay, dear. So, welcome to my lecture number 15. So, I was talking about the ketamine. So, ketamine, we know that the pharmacokinetics. So, ketamines, they are directly absorbed intravenously or intramuscularly. Peak plasma level they are usually achieved within 10 to 15 minutes after intramuscular injection. Its distribution, ketamine is more lipid soluble and less protein bound to the, as compared to the thiopental. So ketamine is lipid soluble. So those drugs which are lipid soluble, it can easily cross the blood-brain barrier. It must be water soluble and it can be excreted from the body. Half life is 10 to 15 minutes. Evacuation is due to redistribution to peripheral compartments. Its biotransformation is occurred in the liver to several metabolites. Norketamine, its excretion is actually the end products of biotransformations. They are excreted renally. The clinical uses of ketamine, so it causes induction of anesthesia. Intravenous ketamine, they are available 1 to 2 milligram per kg body weight. Intramuscularly, if they are administered, so it is almost 4 to 8 milligram per kg body weight. Ketamine produce analgesia. Sub-anesthetic dose of ketamine is 0.2 to 0.5 milligram per kg IV, and neuroaxial analgesia, so this is limited value. Ketamine has different pharmacological effects on different system and central nervous system. It causes cerebral blood flow increase as well as the CMRO become increase as well as the intracranial pressure increase. On cardiovascular system, the sympathetic nervous system stimulation. So systemic and pulmonary arterial blood pressure increase, heart rate increase, cardiac output increase, and myocardial oxygen requirement increase. Ketamine, but in critically ill patient, unexpected decrease in systemic blood pressure and cardiac output, which may reflect a depletion of endogenous catecholamine stored and exhaustion of the sympathetic nervous system compensatory mechanisms, especially unmasking of ketamine direct myocardial depressant effects. Ventilation and airway cause depression of the ventilation, not significant. Upper airway skeletal muscle tone maintains. Upper airway reflexes intact. Salivary and tracheobronchial mucus gland increase. Secretion is increased. Use anti-sialagogues before ketamines and bronchodilatory effect. Drug of choice is a drug of choice for the induction patient with asthma. Let's suppose for asthmatic patient of ketamine, so this is injected, this is drug of choice to cause induction patient with the asthma. These are the specific complications due to use of ketamine. So it causes emergence delirium, psychedelics effects, and post-operative peridvisual auditory and you can say proprioceptive and confusional illusion, which may progress to deliriums. And dreams and hallucination can occur up to 24 hours after the administration of ketamine. Its mechanism is it causes emergence delirium, probably occurred secondary to ketamine-induced depression of the inferior colliculus and medial geniculate nucleus, thus leading to the misinterpretation of audio and visual stimuli. Ketamine, the loss of skin and mucoskeletal sensation results in decreased ability to perceive gravity-producing sensation of bodily detachment or floating in space. What are the factors associated with increase the incidence, or the chance of incidence become high, especially in age greater than, if the person age is greater than 15 years or female with genders. Dose greater than 2 milligram per kg IV, and history of the frequent dreaming, and prevention of ketamine-induced emergency deliriums. Midazolam, it can be administered IV about 5 minutes before induction of anesthesia with ketamine, and prospective discussion with patient about side effect of ketamines. Etomidate, this is another intravenous induction agent. So its structure is closely resembles with carboxylated imidazoles containing compound. Its commercial preparation is Etomidate is prepared as a fat emulsion, and pen on injection and you can say venous irritation is unlikely. The simple mode of action, mechanism of action, Etomidate can directly bind with the GABA receptor, gamma aminobutyric acids. The clinical uses of Etomidate is 0.2 to 0.4 milligram per kg body weight, as an alternative to propofol or barbiturates for the induction of anesthesia, especially in the presence of unstable cardiovascular systems. Now these are the different type of pharmacological effects on the organ system. So in central nervous systems, you can say the potent direct cerebral vasoconstrictors. So it causes vasoconstriction. They decrease the cerebral blood flow and CMRO2. So central nervous system, this is, you can say, a potent direct cerebral vasoconstrictors. And the actios seizures foci, caution attributes with the caution in a patient with focal epilepsy. So this drug will be used with the cautions in a patient with focal epilepsy. It can facilitate the localization of the seizure foci in the patient underlying the cortical resection of the epileptogenic tissue. In cardiovascular system, etomidate causes cardiovascular stability, minimal changes in the heart rate, stroke volume, cardiac output, preferred for the induction of anesthesia in a patient with little or no cardiac reserves. Etomidate cause ventilation, depressant effect on ventilation, pain on injection. So pain on injection in venous irritation has been virtually eliminated with use of etomidate preparation utilizing a lipid emulsion vehicle rather than porphyrin glycol. After that myoclonus spontaneous moment, it should be used with caution in the use of drug for the induction of anesthesia in patient with a history of seizure activity. Adrenocortical suppression, it will last for 4 to 8 hours after intravenous induction dose of etomidate. B considers desirable from the standpoint of stress-free anesthesia. Benzodiazepine, we know that benzodiazepine, it contains multiple group. So midazolam and diazepam, it belong to benzodiazepine. So diazepam, it is also belong to sedative hypnotic agent. So it come under the category of you can say benzodiazepine. It's a sedative hypnotic agent as well as it acts as a skeletal muscle relaxant. So diazepam, we know that the simple mechanism of action of benzodiazepine is facilitating the action of gamma aminobutyric acids. What is gamma aminobutyric acid? Actually it is the principal inhibitory neurotransmitter in the central nervous system. ठीक है, लोग पूछते हैं बेंजोडाइजिपिन के मैकेनिज्म के बारे में, तो सिंपल इसका मैकेनिज्म ऑफ एक्शन ये कि ये डायरेक्टली आपके गाबार्जिक रिसेप्टर के साथ गामा एमिनोब्यूटारिक एसिड, ये इसके लिए मखसूस किस्म के रिसेप्टर्स होते हैं, उसके साथ बाइंड होके, अब गाबा रिसेप्टर है क्या एक्चुअली, ये हमारे पास ये दिस इज द प्रिंसिपल इनहिबिटरी न्यूरोट्रांसमीटर, ये एक प्रिंसिपल इनहिबिटरी न्यूरोट्रांसमीटर है जो हमारे सेंट्रल सिस्टम में पाया जाता है. सो बेंजोडाइजिपिन डू नॉट एक्टिवेट गाबार्जिक रिसेप्टर, ये आपके गाबार्जिक रिसेप्टर को एक्टिवेट नहीं करता, बल्कि इट जस्ट रादर इट कैन एनहांस द एफिनिटी ऑफ द रिसेप्टर कार फॉर गाबा. ये सिर्फ और सिर्फ एक्चुअली ये एनहांस करता है, इंक्रीज करता है द एफिनिटी ऑफ रिसेप्टर का फॉर गाबा, गामा एमिनोब्यूटारिक एसिड. और यानी ये ड्रग की जो टेंडेंसी, उसकी कैपेबिलिटी, उसकी टेंडेंसी, उसकी जो इफिकेसी है, ठीक है, स्पेशली इट कैन एनहांस the efficacy of the receptors for the GABA. So simple, it tells us about the tendency, the capability of a drug which is bound with the receptor. कि एक ड्रग जो है उसके अंदर कितनी एफिशिएंसी, कितनी एबिलिटी के वो एक रिसेप्टर के साथ बाइंड हो जाए. Now come toward the benzodiazepine. So the use in the doses of common benzodiazepine. You look at here, diazepam, it is the agent, so it is used, it is available in oral dosage form. It is used as the free medications at the dose of 0.2 to 0.5 raised to power 2 milligram per kg body weight. So diazepam, it will cause diazepam, it is available in a market by trade name Valium 5, Valium 10, Valium 3. Then it can be given to the patient according to the condition. It causes sedation. So they are also available. It can be given to the patients and through IV route intravenously at the dose of 0.4 to 0.2 milligram per kg body weight. So diazepam is also cause induction. So it can be given through intravenously at the dose of 0.3 to 0.6 milligram per kg body weight. Midazolam, it is also pre-medication. It will also cause sedation and induction. They are available. It can be given to the patient by intramuscular routes. It is a dose of 0.07 to 0.15 milligram per kg body weight. It will also cause sedations at the dose of 0.01 to 0.1 milligram per kg body weight by intravenous infusion. It will midazolam also called induction by IV route. So it will produce the induction at the dose of 0.1 to 0.4 milligram per kg body weight. Lorazepam, it is also used as a pre-medications and oral dosage form, so it will produce, it can orally at 0.053, you can say milligram. And lorazepam, it can be given through intramuscular route at the dose of 0.03, 0.5 raised to the power 3, and it will cause sedation through intravenous route 0.03, 0.4 raised to the power 3. So it means that all these drugs, they are available in intravenous and intramuscular. The maximum dose is 15 milligram. It is not recommended for the children. Now these are the different pharmacological effects of benzodiazepine, which I have already told you that what are the effects of benzodiazepine on cardiovascular system. So minimal cardiovascular depressant effect even in induction doses, arterial blood pressure, so it may slightly decline or cardiac output decrease, peripheral vascular resistance decrease, heart rate it becomes slight rise, midazolam tend to reduce the blood pressure and peripheral vascular resistance more than diazepam. So these are the different effects which are reported here in the literatures. So in respiratory, it depresses the ventilatory response to the carbon dioxide. Apnea may be occurred, may be less common after benzodiazepine inductions than after barbiturate induction. Ventilation must be monitored in all the patients receiving intravenous benzodiazepine, and resuscitation equipment must be immediately available. So as well as benzodiazepine, so it may cause various pharmacological effect on cerebral. So cerebral oxygen consumption, so cerebral blood flow and intracranial pressure become reduced. Anti-seizure properties, so it can integrate amnesia as a pre-medication agents, and mild muscle relaxant properties also there. So it is mediated at the spinal cord level, not the neuromuscular junction. So it can also slow the loss of consciousness and longer recovers. And inshallah, in my next lectures, I will discuss about the different type of opioids like morphine, fentanyl, so fentanyls and mifepridones, and its mechanism of actions, mu receptor, kappa, delta, and how these drugs can bind with the receptor to show pharmacological action. Thank you so much for watching my lecture.